Dr. Prada. I'm the head dentist at DDS Dental Costa Rica, and today we're going to talk about the all-on 4 or all-on 5, all-on 6. Most of it the prosthetic part, but we'll talk a little bit about the rest too. And I'm going to do it by presenting you a case where you see the patient has hopeless teeth, and you can see here the final result, how we did this full restoration over implants with zirconia bridges. So here you can see the patient, the before and after. This is the patient with hopeless teeth, and you can see the final bridge, and we'll see how to go from here to here, all the steps that are needed. And again, the case with this patient with hopeless teeth because of periodontal disease, a lot of bone loss, but always or most times with enough bone to place the implants, either with bone grafts or not. So after the implants, we're not going to talk about all the surgical part. We can talk about that in a separate video. We're talking mostly about the restorative work, but in this case, implant placement, and we did immediate temporary resin bridges. So in this case, we decided to place more implants, a lot based on patient's choice, bone availability, and also, of course, cost will vary if we do 4 implants, or in this case, 8 on top and 6 on bottom. So we do all on 4, all on 5, all on 6, all on 8, and depends again a lot on the patient preferences and bone availability and so on. So after the implants were placed, this is how the patient would leave home with fixed teeth. In most instances, we can do fixed teeth, but this would depend on bone quality and how stable the implants can be at that time. If they're very stable in the bone, we can do fixed bridges. If they're not, we would have to do removable dentures. I would say on the bottom, 95% of the cases we can do fixed. On the top, maybe 60 or 70% of the cases we can do fixed, and the other cases we would suggest doing something removable, like removable dentures. And again, I'm going to present a case, the step by step, so you can see what you're going to go through. You can see here the before the patient. You see here on the teeth as they were, and this is the temporary teeth made right after. These temporary teeth may not be perfect, but they're usually a good improvement of what the patient had before. This is another case just to present you with different alternatives. The patient had hopeless teeth on the top, so they were taken out. So we placed, this is different kind of implants. This is much longer, different kind of implants, but at the end it's the same 4 implants. This patient kept the lower teeth that of course needed to be fixed, but you can see right after surgery how the patient would present to me after the surgery with these posts over the implants, and I would take a full denture and convert it into a fixed denture, making holes to the denture and putting posts on the implants. We would convert that full removable denture into this fixed temporary denture. As you can see, this is immediately after surgery or the day after. Sometimes it's not the same day, but the day after. We have up to a few days after the implants have been placed, so we can finalize a fixed bridge over the implants. Here you see another view, and you see these holes over here, which is where the fixed bridge would be screwed in, and then we put some temporary material over there. This fixed bridge is a little bit thicker than what the final will be, but it's a comfortable bridge. Here you can see the before with the hopeless teeth, and the immediately after implant placement and a fixed bridge, temporary fixed bridge being done. Here's another case. You can see the before and the after with the temporary fixed bridges. So the patient would leave home. Usually, if the patient lives abroad, would leave home and then come back 3 to 6 months later so we can finalize treatment. So the patient would come in, we will take the temporary bridges out so we can start making final impressions. And this is what we do after we take the fixed temporary bridge. We will put these posts, impression posts, so we can start making final impressions, final mold. We would set it up in the articulator so we can set up some teeth, and we start doing try-ins. We want to be sure that the teeth we're doing are in the right position with the right shape. So we would place some teeth, put it in your mouth and do some try-ins, see your smile, even let you go home with it so you can see if you feel comfortable with the position and how much they're exposed and so on. And if you do like it, we need to take a color of your gum too. Some cases, or most cases, there's going to be some pink involved in the final restoration. So we have color guides even for the pink too. And once we have all the information, we would send to the lab to be finished. And this would be the finished bridge. This is somebody that wants a natural color. You may be thinking this is too yellow, but some patients would like a natural look. And of course, if the patient wants a bleach color, we can make it as white or as natural looking as the patient wants. You can see the screw holes here, how you would comb out the bridge. So we would put it in the mouth and screw it in place. And then after it's screwed in, of course, those holes are filled with a filling resin. You can see here the final bridge in the mouth, and you can see how the artificial pink, and then you can see the natural pink of the patient. You can see another view. You see how where the screw holes were, we would put some resin on. The others you can barely see because the resin is the same color as the bridge, so it looks very, very natural. You see the bottom here, and a few you may see. You see the screw hole here, and the other screw holes are somewhere around here. You can barely see the screw holes after they're filled with resin. You can see here the smile. In the smile, you can only see the artificial pink. You can't see the natural pink. Even in a big smile, you won't see the transition from the artificial pink and the natural pink, so it looks good. You can see here another view of the smile. And the final X-ray would show one of the very important or absolutely important things is that the fit is absolutely perfect. So you can see a perfectly well-fitting bridge, and this is absolutely important for the success rate of the bridge. So as you can see, from the natural teeth to the final result, we have many try-ins. So when we get to the final zirconia bridge, we're absolutely sure that it looks great. From the immediate temporary fixed teeth, from a first initial try-in, a milled bridge try-in that we make, to the final zirconia bridge. So we're absolutely sure that the fit, the looks, the bite, and everything is perfect. The alternative to this zirconia bridge is the alternative to the zirconia bridge is this conventional fixed bridge, which is called the hybrid denture. It's a metal bar with denture teeth. You can see here there's advantages and disadvantages to one and the other. This is something we can discuss in detail or in another video. So you can make a decision if you want a final zirconia bridge or a conventional fixed bridge with a metal bar and denture teeth over it. I hope this video can help you understand the whole process and help you make a final decision. Talk to you later. Bye-bye.